Hello, good morning students. As the part of our curriculum from the subject Pharmacology, I'm going to start with the topic Introduction to Pharmacology, which is from the Unit 1, which will be going through the remaining session of this lecture. So if you would see the history of the pioneers of medicine and pharmacology, what we have it all started at the age of the Hippocrates in 450 BC, which is referred to as the father of medicine. Then Francois Mackay in 1783 to 1855, who was referred to as the father of experimental physiology. Then we have the Claude Bernard, which is 1813 to 1878, who was termed as to be a pioneer of modern physiology. And then we have the Rudolf Beckham, which is 1820 to 1879, who has the pioneering work in experimental pharmacology. Then we have the primitive men who gather the knowledge regarding the healing and the medicine by observing the nature, noticing the animals while ill, and personal experience after consuming plants and herbs as remedies. So what they came to know that if a person is fallen sick or he wants to heal from the disease, he can always seek the nature, and he would find the sources from the nature to heal itself. The ancient civilization, what they discovered, that extracts from the plants, that the plant what we have it in the nature, we take an extract of them, then we have the animal source, and then we have the mineral source, which can be used as a medicinal effects on the body and the tissue. These discoveries became the foundation of the pharmacology. From here, the branch of pharmacology started developing, and they took the nature, the available resources which was having from the nature, the animal, the minerals. From there, they took the extract and they started treating the diseases or illness. Then, if you would go back to Passos in 2700 BC, what we say, they have used the great herbal material medication to treat the patients, which was written in the ancient text of China. Then we have the Kahun Papyrus, which is 2000 BC, is the oldest Egyptian document who gave the information about veterinary medicines and uterine disease of the woman. So it is believed that the ancient people, the ancient civilization, were already knowing about the disease and how we can treat that disease with the help of the available resources. Then another papyrus in 1550 BC also is an Egyptian document who said that the diseases and 829 prescriptions were added on the diseases, which comprises of the castor oil, opium-like drugs, which can be used on the treating of the patients. Then pharmacology in the present form is relatively recent branch, which is about 100 years old. As the development started, as the researchers took a keen interest in how these plants and medicines can be collaborated to treat the diseases, the pharmacology branch started to develop. Now, the definition of the pharmacology. Pharmacology is defined as the science that deals with the study of drugs and their interaction with the living system. How a particular drug is interacting or having an action on the particular physiology or the living systems. Then the word pharmacology, which is derived from the Greek word, which is pharmakon, which has the meaning that drug, and logos means the study. So how the drug is acting is the study of, we call it as a pharmacology. Then there is another definition for the drug. The drug is a substance used in the diagnosis, prevention or treatment of the disease. So drug is a substance which is used to diagnose, prevent or treat a particular disease. Then we have another terminology which we are going to use it further along from the the syllabus of the pharmacology, which will be pharmacokinetics. So here are two words. We have the pharmakon and then we have the kinetics. So pharmakon, we have already learned about the definition of pharmacology, and kinetics is the movement. So what does the pharmacokinetics means? So pharmacokinetics is the study of the absorption, distribution, metabolism, and excretion of the drug. That is what the body does to the drug. Okay, so that is what I said. The kinesis is the movement. So what we can have, we can have the absorption, how the drug is absorbed in the body, the distribution of a drug, how it is being transported from the various sources which we are going to learn it afterwards to the different parts of the body, the metabolism, how it is broken down, okay, the substances inside the drug, how it is being broken down, metabolized, and how it is excreted from the body. So these are the key terminologies under the pharmacokinetics: absorption, distribution, metabolism, and excretion of the drug. Then we have another one definition or another terminology which we call it as a pharmacodynamics. Here again there are two words. We have pharmaco and then we have dynamics. Dynamics is the effect of the drugs on the body and their mechanism of action. That is what the drug does to the body. So if, for example, if I have given a paracetamol drug for the fever, this paracetamol has to reduce down the fever. That is nothing but the pharmacodynamics. Then we have therapeutics. The terminology is a therapeutics, which deals with the use of a drug in the prevention and treatment of a disease. Then we have a toxicology. Toxicology is the adverse effect of the drug, or we call it as the side effect of a drug, and also the study of poisons. That is, how the poisons have been detected, how it is prevented, and the treatment of the poisoning. So toxic, you already know about the toxic. Toxic is the, the poison in the Greek word. Then we have chemotherapy, use of the chemicals for the treatment of infections. The term now is also includes the use of chemicals to treat the malignancies. So many of the time you might have heard about, the majority of the treatment for the cancer cells are chemotherapeutic drug. Okay, so chemotherapy is nothing but the chemicals which we use it to treat the disease. Then we have the pharmacy. It is the science of identification, compounding, and dispensing of drugs. Okay, so if you go to outside in the market, you would see various pharmacy shops. Okay, and the person who sits in the pharmacy is the pharmacist. So what is the main role of a pharmacy is to identify the drug. For example, particular disease is present in a geological area. So if the drug is available to treat that disease, that drug has to be identified and kept into the pharmacy. Then compounding, we have to compound the available drug what is being given to us and dispense it to the demands of the various sources. Like we have the demands from the hospital, then we have the demands from the doctor, physicians, then we have the demands, some of the drugs which are there on the over the counter, okay, which is another terminology, means the drug which does not require a prescription from the doctor can be sold on the over the counter medicines. So it also includes collection, isolation, purification, synthesis, and standardization for the medicinal substance. Then coming to a very important aspect of the introduction to pharmacology is the sources of drug. Many of the time in the examination you would find this question: what are the sources of the drug, or explain the sources of the drug. So we have the sources of drug which can be, sources could be natural or synthetic. Natural means these are readily available. Synthetic means what? We have to make it into the laboratories, okay, or we can artificially has to make that substance chemically. Okay, so we have a natural source. So the first one is natural source. So we have the plants. Okay, so the plants examples: atropine, morphine, quinine, decoxin. Then we have the kilocappa, and then we have the physosamine. Okay, so these are all the medicines or drugs which are derived from the plant as the source. You might have seen mostly atropine, which is being used to increase the heart rate. Then morphines are used for the treatment of the pain. Okay, then we have the quinine. Okay, so these are all the plant sources. Then we have the animal sources. Classic example of the animal source is the insulin. which is a drug given for the patients who are having diabetes mellitus. Okay, so the insulin dependent diabetes mellitus, for those patients we give insulin. So these insulins have been derived from the islets of Langerhans cells from the animal sources. Okay, then we have the heparin, then we have the gonadotropins. Most of the gonadotropins have been extracted from the animal sources, and then we have the antitoxic seras. Okay, and then we have the minerals. So minerals, like we have various minerals which are available in our nature or in our environment. We have magnesium sulfate, then we have aluminum hydroxide, sulfur and radioactive isotopes which are available in the environment. We extract them, we take them from the environment, and then we process it, and then we make it as the medicinal use. And then we have the microorganisms. Most of the microorganisms are the good bacteria. Okay, so we call it as antibacterial agents which are obtained from some bacteria and fungi. We thus have penicillin, cephalosporin, tetracycline and other antibiotics which are derived from the other microorganisms as the source of the drug. Then we have humans. Humans, yes, we do have the extract from the humans which we take it as the drug. So for example, we have the drugs which have been taken from the extract from the human that are immunoglobulins from the blood. Then we have the growth hormones from the anterior pituitary gland, and then we have the chorionic gonadotropins which have been also taken from the urine of the pregnant woman. So these are the drugs we take it from the source as the humans. Then we have the synthetic, coming to the second type, the natural and the synthetic. So the synthetic drug, so we have most of the drugs which are synthesized, that is, as I said earlier, it is being made into the laboratories. So like for example, we have quinolones, then we have the amiprozoles, sulfonamides, pancuronium, then we have the neostigmines. These are the example. I'm just giving an example of these drugs which have been synthesized into the laboratories. Many drugs are also obtained from the cell culture. Now, if you have learnt about the cell culture in your the earlier days of the academics, you would come to know that we culture the cell in a particular and the controlled environment, and then we extract the contents, the chemical contents from it. For example, urokinase, which is a very potent drug which is being cultured from the kidney cells, and which we use it into treating of the the patients who are having the blood clots. Okay, then some are now produced by the recombinant DNA technology. You might have heard about during the COVID time also. DNA technologies have been used to make the vaccines and the seras to fight against the infections. Okay, so human insulin, tissue plasminogen activator, and some of the drugs by hybridoma technique, which is monoclonal antibodies, which are all made into the research laboratories, and those drugs have been then they have the process of correcting the drug, they have the process of checking whether the drug is having a desired effect. Okay, so we call it as a mechanism of action of a drug on the particular animal, and then when it is been certified, then the drug comes out into the market as a certified use on the humans. Then another one important question which might be asked into your examinations, or which is very important, is the routes of drug administration. Like, we have come to know about what is drug. Okay, we have come to know about how the drug is distributed and what is the desired effect of the drug on our human body. Then the sources, like we have the natural source and the synthetic source. Natural sources are derived from the naturally occurring substances like plants and minerals. Then synthetic drugs which have been manufactured and done into the the laboratories. Now we would have to know how these drugs have been given to the particular patient or a particular disease. So we come to know about the routes of drug administration. Now drugs may be administered by various routes. It's the choice of the route in a given patient depends on the properties of the drug, very important, the drug's property, and the patient requirements. Say for example, if a patient is having gastrointestinal problem and we want to administer a drug. So these patients need to have the requirements, the patient's requirement or the properties of the drug, whether the drug is water soluble, whether the drug is having properties of dissolving with another chemical. So these are all the things we depend to choose the route of administration of the drug. A knowledge of advantage and disadvantage of the routes of the drug administration is also essential. So for example, you want to minimize the risk of complications and adverse effect to the patients. So always the routes of administration is considered beforehand only while giving the drugs to the patient. Now there are three main routes which we give the medications to the patients. We have the enteral route, then we have the parenteral route, and then we have the local route. Okay, so we are going to see it in detail what are these routes are. So coming to the first route, that is the enteral route. Now enteral route is, you have to understand, which is entered into our oral system, okay, or a GI system. So it is a oral ingestion of the drug. This is the most commonest, oldest and safest route of drug administration. So you have to remember it is most commonest. Most of the medications, they come in the oral forms. Okay, then we have the oldest, which is being used from the ancient time, and the safest route of administration of the drug. Now when we say safest route, that means when a person takes the medication through his mouth, he does not have any piercing, any injuries to the patient. The large surface area of the GI tract, the mixing of its content and the differences in the pH at different parts of our gut or the intestine help effective absorption of the drug given orally. So if the drug is given per oral, it goes into our GI system and then it gets absorbed into our GI system. So where variety of the properties of the drugs have been responsible. Say for example, the mixing of its content and the differences in the pH of the stomach, because you know that most of the time the pH of the stomach is acidic because of the gastric acids which have been secreted, and then we have the metabolism and the digestions of the various aspects like proteins needs to be absorbed and digested into the into the stomach because of the HCl. So that is the property of a drug which will be again we will have to consider before giving the oral medication. The advantage, yes, it is one of the safest route. Okay, as we had discussed earlier, it is only the ingestion of oral tablet or a capsule or the form which is being the drug is made up of, which is only used for the oral purpose. Most convenient, yes, we can give it to the patients. It's very convenient for the patient to use. Most economical, mostly the oral forms of drugs are available in a much more cheaper price as compared to the other forms, like we have the intravascular medications. Then most drugs can be self-administered, yes. So if a patient is there and he needs to be administered the medication per orally, we can advise him and we can teach them how to take the oral medication. But whereas in other routes, a skillful personnel is required to administer a drug, whether it is a nurse or whether it is a physician or the residents which are available at the time of duty. Then it is non-invasive. As I said, it does not require any piercing. So we are not going to pierce anything into the patient's body and administer the drug. Disadvantages, always remember whenever we talk about the routes of administrations, we have the advantages over the disadvantages or vice versa. So disadvantages, onset of action is very slower as absorption needs time. So it goes to the GI system, it goes to the stomach, it needs to get absorbed, then it would circulate into the systemic circulation and then it will reach to the target organ. So the journey is very long, so it is very slower for the absorption. Then irritant and unpalatable drugs cannot be administered. Many times you might have faced when you might have seen in the childhood, many children, they do not want to take the oral medication because it they do not like the taste of it. So many of the drugs which is very irritant and unpalatable, which cannot be given into the oral form. Some drugs may not be absorbed due to the certain physical characteristics, like streptomycin, as I said earlier, the drug to drug interaction, or the properties of the drug, how it is been administered. So in the oral medications, some of the oral medication is not absorbed because of the physical characteristics. Then there may be irregularities in the absorption. Sometimes the absorption is very slow, sometimes the absorption is very fast. The adverse reaction can develop very fast for the patient. Irritation to the GI system or GI tract may lead to the vomiting. It has happened so many times with the patients in my care. Whenever we used to give the medicine to the patient per orally, if they are feeling nauseated, they will always puke out the medicine. So the vomiting will be there. Some drugs may be also destroyed by the gastric acid. As I said, the pH level, the gastric acid has the higher pH level. So insulin, if it is given in oral form, it is being not absorbed and it is been not been any use because it gets destroyed. Then it cannot be given to unconscious and uncooperative patient. Unconscious patient, they do not have the gag reflex. So if you give the tablet, they would not ingest it. Okay, so and then the patient who are uncooperative, like they would just not take the medicine, they would just vomit it out. Okay, then some drugs may also undergo extensive first pass mechanism or metabolism into the liver. Now the first pass metabolism is the time when the drug first reaches to the liver, and most of the time you know that the liver acts as the detoxifiers, or the any substance which goes into the human body goes to the liver to get it metabolized, and then it is being transferred. So some drugs, they have the extensive, very vast first pass metabolism they would have. Then patients may forget to take the tablet, which is the practical problem. Many times the complaints have been received like patient did not take the medicines. Why? Because they forget. And some of the time it is our responsibility also that we take the utmost care to give the medicine to the patient in his hand, and in front of our eyes only he has to take the medications. But sometimes patient may forget. Then coming to the next, entry coated tablet. This is also another one important aspect, and as part of your examination also this particular topic is very important. Entry coated tablet. Explain entry coated tablet, or what are the entry coated tablets. So some tablets are coated with substance like cellulose, acetate, or we also have the phthalate, gluten, etc. These are all substances which do not get absorbed or digested into the gastric acid, into the stomach, but it passes through the stomach and it gets disintegrated in the alkaline juices of the intestine. So if you want to have the therapeutic effect of the drug, particularly from the intestine, then we give the enteric coated tablet. So this will, what they do, they prevent the gastric irritations. As I said, some of the medicines or some of the drugs, they go and irritate the gastric mucosa because they are having that properties. Then avoid the destruction of the drugs by the stomach. Some of the the chemicals, the drugs which are there, might get destroyed into the stomach because of its acidic environment. So to avoid the destruction of those drugs have been given into the entry coated tablet. For this, I have to bring you back to the point where we discussed that some of the in the previous slide, the disadvantage, like we had seen that the some of the medicines, like for example streptomycins, okay, or the antibiotics, which does not get get absorbed because they have been destroyed into the gastric acid, which are been made into the capsule form, the cellulose capsules. You might have seen it that most of the antibiotics, they come in a capsule form. So they have this entry coated phenomena. So because of that, it only gets disintegrated into the small intestine. Then slow the absorption, and then there are prolong the duration of the action. So slowly the cellulose substance, the gel-like substance or the gluten-like substance will get disintegrated into the alkaline environment of the intestine, okay, and then slowly it will release the drugs into the system, which will increase the duration of the action for the particular drug. Now, advantages: frequency of administration may be reduced. Okay, so frequency is what? How many times the drug is being given to the patient on a particular day. Say for example, once daily. So we call it as the frequency of the drug is once daily. Then we have twice daily. Okay, so we write BD. Okay, so those are all the terminologies we would learn about in the next lectures. Then therapeutic concentration may be maintained for a long time, especially when nocturnal symptoms are to be treated. Nocturnal symptoms is another new word for you. So which are the nighttime symptoms? Okay, so nocturnal means for the night, which are to be treated, and this can be given into the entry-coated tablets. Then disadvantages: it is more expensive. The manufacturing cost for these drugs are increasing because we are using extra substances to coat the particular drug. So it will be more expensive. There may be also release of the entire amount of the drug in a short time, leading to toxicity. It happens so that the alkaline nature of the intestine suddenly increases, so much the gut motility increases, and the drug gets absorbed very fast, and then the patients will have the toxic reactions. And then the next route, we have the parenteral route. Parenteral route is other than the oral route, other than the enteral route. Okay, so enteral is the term which we call it for the oral route. Okay, so parenteral, other than the enteral route or the oral route, known as the parenteral route. Here the drugs are directly delivered into the tissue fluids or the blood. Okay, directly into the tissue fluids or into the blood. What are the advantages of directly inserting the drugs at the target organ? Action is more rapid and predictable than the oral administration. So once I know, if I use a parenteral route of administration of a drug, I know the next moment it will show the action. Okay, the reactions will be there, action or reactions. Okay, so we are very having a predictable amount of the time than the oral route. These routes can be also employed in an unconscious patient or uncooperative patient. Many times, if there is a patient who is uncooperative, so we just give them the relaxants, and the patient goes to relaxed state, and then we can do the procedure. So uncooperative patients is very important to use the parenteral route. Then gastric irritant can be given parenterally, and therefore the irritation to the GI tract can be also avoided. Remember earlier we discussed about some of the drugs, they cause the adverse gastric reactions or irritability into the stomach. So to avoid the irritability of the stomach or the GI tract, gastrointestinal tract, we can give these drugs into the parenteral form. It can be also used in patients with vomiting or those who are unable to swallow. In the oral route, the patient is having vomiting symptoms, or if he is not having a gag reflex, he will not be given an oral medication. So instead of having the oral routes of administration of a drug, we can use the parenteral route. In emergencies, parenteral routes are also very useful. In an emergency, we want to have the quick result or quick action of the drug, where we do not have a time to waste when we are saving the life of a patient. We always prefer to have the parenteral routes of administration. Then digestion by the gastric and intestinal juices and the first pass metabolisms are directly avoided because we are injecting the drug directly into the system, okay, directly into the body fluids or directly into the blood. So these all gastric juices, intestinal juices and the first pass metabolisms can be avoided, and the drug reaches to the target organ very fast, and we have the resultant action. Coming to the disadvantages, very important, asepsis has to be maintained. Asepsis means what? We have to Maintain the sterility while administering a drug. Now this is another one chapter which we are going to have it for you, where we'll discuss what is the aseptic techniques and what is the difference between the aseptic techniques and septic techniques. Okay, and how do we have the preparation of a drug into an aseptic technique. Okay, so asepsis has to be maintained, means avoidance of the infection is very important. Injection may be also painful. Many times the patient they have very less threshold towards the pain of the injection site, okay, or by the routes of administration. So it's very difficult for those patients to have the control over the pain. More expensive but less safe and inconvenient. Okay, so if you would see the intravascular injections or intramuscular injections form, so these are very expensive as compared to the oral routes of administration of medication, and these are very less safe because it can introduce the infection and it is also inconvenient. Injury to the nerve and other tissues may occur. It's a very important point you have to keep into your mind. Whenever you are performing any intramuscular injections, always try to do with the proper administration methods, which we call it as a Z method, okay, Z method of administration of IM injections, where we particularly avoid the sciatic nerve branches which have been going into the hip area. Okay, so mostly these nerves might get damaged if it is punctured by the needle of the injecting. So what are the routes, what are the methods, or we have the route for the parenteral root. We have injections, then we have inhalations, then we have a transdermal route. Transdermal, trans means above the dermis, dermal is the dermis layer of the skin, and then we have the transmucosal through the mucosal lining. Coming to the injections. So injections, again we have the variety of the different type, like we have the transdermal injections. Okay, so injections can be included into transdermal. The drug is injected into the layers of the skin by raising a blood. BCG vaccination, you might have seen it from the childhood. We give tests for the allergies like tuberculin skin test, allergic skin test. We use it to introduce the injectable drug under the skin, transdermal, under the skin, by multiple punctures of the epidermis through a drop of the drug. Example, smallpox vaccines. Earlier days we used to have these techniques where the injections have been given in a multiple punctures of the epidermis. Okay. Then only a small quantity can be administered by this method because it is under the skin. The surface area for the drug is very less, so very small quantity of the drug is administered through the intradermal route. Then we have the subcutaneous injection. Subcutaneous injections under the subcutaneous tissue. Okay, here the drug is deposited in the subcutaneous tissue. Examples, classic example is insulin injection. You would see the insulin injections when the patients are given insulin injections, they are given into a specialized syringe. Okay, and that syringe has very small needle, so which can only be get access till the subcutaneous tissue. Then we have some of the drugs which are given into the subcutaneous route is heparin, which we commonly use it as this tissue is very less vascular, absorption is slow and largely uniform, and this makes the drug to perform its action for a long period of time. So insulin, for example, if you give insulin in the morning for the patient, the entire day the patients will have insulin levels being maintained properly. Disadvantages: subcutaneous tissue is richly supplied by the nerves. Okay, so it causes a lot of pain. Okay, irritant drugs cannot be injected into the subcutaneous route. Then in a shock absorption is not dependable because of the vasoconstriction. When the vessels become constricted, it cannot be absorbed. Okay, so mostly in an emergency conditions, we do not give the injections into the subcutaneous tissue. Say for example, if the patient is having blood clots in his major arteries, so we are not going to give heparin into his subcutaneous tissue. We have to dilute it and then give it into the intravascular route. Then repeated administration at the same site can cause lipotrophy, resulting into the erratic absorption. Okay, so very important, like lipotrophy is the reduction into the surface area, which can lead to have the erratic absorption. Then drugs can also be administered subcutaneously as Dermojet. Okay, so this method is a high velocity jet of drug solution is projected from a fine orifice opening using a gun. The solution gets deposited in the subcutaneous tissue from where it is absorbed. As the needle is not required, this method is painless. It is suitable for the vaccines. Okay, so what do we have? We have the instrument, which here we call it as a gun. We have the we load the drug into the system and then we inject it from the distance. Okay, so that the jet, high propulsive jet of the medication in a solution form goes and directly pierces into the subcutaneous tissue. Then we have the pellet implantation. Small pellets or the small fragments are being made, packed with the drugs, are implanted into the subcutaneous tissue with a small puncture. The drug is getting slowly released for weeks or the months to provide the constant blood levels. Example like testosterone injections. Then we have the deoxycorticosterone acetate. Okay, so these are all the drugs which we give it into a small pellet. We make a small puncture, put it into the subcutaneous tissue, and then it gets absorbed. Then we have the salicylic implants, which are again the salicylic tubes are there, which we implanted into the subcutaneous tissue. The drug gets absorbed over months to provide the constant blood levels. Examples like hormones. Most of the time in woman-related diseases, we have this salicylic tubes which have been implanted into the the woman, and then it can have the release of the hormones like contraceptives. Okay, and then we also have non-biodegradable implant which has to be removed afterwards. Okay, so we just open up the incision again and we take out the implanted material and we replace it with the new one. Then second one is intramuscular, which is another one widely used route of administration of medicine, where the aqueous solution of the drug is injected into one of the large skeletal muscles. So what are the skeletal muscles? Deltoid muscle, which is present into our upper extremities. Then we have the tricep muscle, again into the upper extremity. Gluteus, which is there in the lower extremity, and then the rectus femoris, which is there on the lower extremities, mostly on the thighs. So what is okay? So absorption into the plasma occurs by simple diffusion when we give to the intramuscular injection. Large molecules enter through the lymphatic channels. As the muscles are very vascular, absorption is rapid and quite uniform. So it gets distributed. The pharmacokinetics of these drugs through intramuscular injections are very distributed because of the vascular natures, vascular availability of the muscles. Then drugs are reabsorbed faster from the deltoid region than gluteal region, especially in women. So, the deltoid region is the upper extremity and the gluteal region is the lower extremity. So, for the woman, deltoid region gets more absorbed than the gluteal region. The volume of the injection should not exceed more than 10 ml. So, we cannot have 50 ml of the medication which is being given into the intramuscular route. We cannot do that, because what will happen? It will be very large quantity. So we use the intravascular syringe pumps to administer drugs. For infants, rectus femoris is used instead of gluteal muscle. So rectus femoris is in the thigh, the anterior aspect of the thigh. Instead of having the rectus instead of having the gluteal muscle, we use it for the infant on the thighs, which is not well developed because of the child has not yet started walking. But that is the common example of why the children are given injections on the thighs. Smaller volume like 1 to 2 ml in the deltoid muscle is used. In large volumes, gluteal muscles should be used. So for example, tetanus toxide, we mostly use it on the deltoid muscle because it's a very small quantity. Okay, and then we have the large quantities like we have paracetamols, or we have the non-steroidal anti-inflammatory drugs which have been given into the gluteal muscle of the lower extremities. Soluble substances, mild irritants, depot preparations, suspensions and colloids can be injected by this route. Yes. We use mild irritants, then we also have the colloidal substance, and then we have the soluble substance which gets solute into the tissue fluids. What are the advantages? Intramuscular injections are very reliable. So when we give the intramuscular route, we are very sure that the drug is going to get absorbed very fine. Then absorption is very rapid. The onset of the actions are very fast. Disadvantages, again, IM injections may be very painful. Some of the patients, they might not tolerate the injections into their muscles. It may also result into an abscess formation. If the aseptic technique is not used, it can lead to start forming the infection in the site of the injection. Risk for nerve injury, as I said, if you do not use the Z method of administration of the medication, it can lead to damage to the nerves which are passing from the hip joint. The needle may also be punctured into the blood vessels. Majority of the time it is happened that when we inject into the intramuscular route, we have to counter aspirate, so we have to see whether the blood has been coming out or not. So if the blood vessels are damaged, we avoid giving the injection into that particular point. In coming to the intravenous route, IV route. Intravenous, here the drug is injected into one of the superficial veins so that it directly reaches to the circulation and is immediately available for the action. So from the superficial veins of the hands, legs, okay, or on the scalp, okay, and on the heel, we use it so that directly goes into the circulation. Drugs can be given IV as the bolus. Bolus is the small quantity which can be given, which is dissolved in a suitable amount of a vehicle and injected slowly. Initial large doses is given. Examples, heparin. So bolus of heparin be relatively large. Then slowly over 15 to 20 minutes. Examples are aminophylline. Okay, then we have the slow infusion when constant plasma concentrations are required. Examples are oxytocin in labor. Or when large volumes have to be given. Example is dextrose or the saline. What are the advantages of having the IV route? IV routes is very useful in an emergency condition.